to Frank Fridays at Pfizer Family Dental. I'm Dr. Pfizer. Good to see everybody out there thawed out after the snow, and it was plenty warm this last week. Today we've got a couple topics to share with you. The first, if you saw our previous post from, I believe it was yesterday or the day before, an article that was in a journal, dental journal, the American Academy of Periodontists. But it was an article that was showing the effectiveness of dental offices and the dental staff in combating spread of COVID. Dental offices, a lot of people tend to think of dental offices as being extremely dirty because of all the people coming in, all the work that we're doing, aerosols and things like that will be generated. But the truth is actually kind of the complete opposite. The dental office is one of the cleanest places that you could go to, because even before COVID, we have always taken great care and gone to great lengths to keep things clean in our office. We don't want to spread anything around, regardless of it's being something as simple as a cold virus all the way up to HIV virus or tuberculosis or something like that. We sanitize every surface after every patient comes into a room. We sanitize all of our front counters, anywhere that people are going to come in contact with. We have always kept those clean, and we have done the same thing since COVID has started, and we've even increased some of our procedures to make sure that things stay clean. We have hand sanitizer in every room, on every surface, available to all of our staff and all of our patients that come through the office. So, long story short, don't be scared about going to the dental office. It is very clean, and you are extremely unlikely to get some form of disease, whether it's COVID or a cold or the flu or anything like that, from a dental office, certainly compared to just anywhere else out in the world. So if you get a chance, look at that article. It's a pretty good read, at least to help you feel better about going to the dental office and not be scared. Our second topic for today is we are in our central sterilization lab in our office, and this is where we do all of our cleaning of the instruments and the materials that will actually come in contact with you when you come in for a filling or a cleaning or any procedure with us. And this kind of starts, this is the office here, or the lab is arranged kind of a dirty side to a clean side. So when we do a procedure, we finish up, we clean the room after a patient's left, and then we bring our instruments and materials into here, and we start bringing right over here into the sink. So the first thing that we'll do, our staff, they glove up, PPE, in here just like they do in the room with the patients. We wear gloves, and I don't have my mask on since there are no patients in, and no issues with that, but we'll wear eye protection. And the first thing we'll do, so for brevity's sake, I just have a single instrument. I don't have a whole tray of them, but this is a scaler that you might see if you're getting your teeth cleaned. So if that hygienist is having to really kind of scrape on your teeth to clean some stuff off, this is what they use. With our staff, we'll put on some gloves. So the very first thing we do with the instruments, and these are sized for my staff, not for me. These are a little bit small. So bear with me as I try to get these on. Yeah, almost there. My hands don't cramp up. Okay. First thing is we just scrub off the gross material that's on there. Not gross as in nasty, gross as in just the large amounts and the large pieces. So we clean off the main stuff, get them cleaned up of any big pieces of, calculus, tartar. If there's any blood or anything on them, we clean that off right here. Get that off, and then we go to an ultrasonic. And I don't know if you can get up here and see, there's a special cleaner liquid inside the ultrasonic. Looks a little bit blue. So that will be placed in, and then we turn that on. And that actually vibrates and gets all those little fine particles off of the instrument and starts to get it clean and ready for the next step in cleaning. So once we get done with the ultrasonic, and we deglove, which will take me a little bit. The instruments will go from there, they'll be dried off, and then we place them into sterilization pouches. And this is a set of cleaning instruments and exam instruments for our office, but they'll go from here. Once we get enough, they go across to our autoclave. And we actually had some to run earlier this morning, but the autoclave works by, you can see we've got trays with the bags of instruments from previous patients. Once this is filled up, we close it back up, and this will actually heat up, and it's sealed, so we sterilize the instruments through pressure and heat. It actually gets up to around 270 to 275 degrees Fahrenheit, and with pressure and steam inside to sterilize everything. It runs a test every day to ensure that it is still meeting all the standards to sterilize and disinfect even the hardest microorganisms to kill. So no worries about transmitting things. We do all these steps to ensure that the instruments that we use on you and any materials that we might use, like a bite block, any extra mirrors, anything like that, are completely sterile and clean and ready to go. And the last thing, just kind of an assortment of some of the materials that we use that are cleaned. Some of them come pre-sterile and packaged from our suppliers, like sutures if you have to have a tooth taken out, suctions. And this is another new product we have. We call this a dry shield. This helps to isolate your teeth whenever we are working, but it's also suction and keeps things clean and dry, and it actually pulls the aerosols in. So whenever a dentist is working with a handpiece and there's that little fine spray, this actually has constant suction from inside your mouth to pull all that down, cuts the amount of aerosols that will produce and get into the air, in the office. So another step to help combat the spread of any viruses that we have. Gauze, whenever we are wiping instruments off or wiping something that we're working with, or if you have a tooth taken out and we send you home with gauze, it is sterilized before we give it to you. It's not just out of a box, handed to you. It's extra clean. But that's kind of the quick rundown of our sterilization system for our office. But just know that everything we do is clean and safe for all of our patients. Thank you for joining us today. We will see you next time on Frank Friday.